A birth defect is a problem that occurs when a baby is developing in utero. Approximately 1 out of every 33 babies in the United States is born with a birth defect. Birth defect can be a result of genetics, lifestyle choices and behaviors, exposure to certain medication and chemicals, infection during pregnancy, and a combination of these factors. However, the exact cause of certain birth defects are often unknown. The one of the most common type of functional or developmental birth defect is Down syndrome, which causes delayed physical and mental development. In every cell in the human body, there is a nucleus where genetic material is stored in genes. Genes carry the code responsible for all of our inherited traits and are grouped along rope-like structure called chromosomes. Typically, the nucleus of each cell contains 23 pairs of chromosomes, half of which are inherited from each parent. Down syndrome occurs when an individual has a full or partial extra copy of chromosome 21. Most children with Down syndrome have distinctive facial features such as a flat face, small ears, slanting eyes, and a small mouth, a short neck and short arms and legs, low muscle tone and loose joints. Muscle tone usually improved by late childhood, below average intelligence. These health conditions often lead to other problems, such as airway infections or hearing loss. Down syndrome continues to be the most common chromosome disorder. Each year, about 6,000 babies are born with Down syndrome, which is about 1 in every 700 babies born. How is Down syndrome diagnosed? Tests to diagnose Down syndrome include the following: prenatal screening test, prenatal diagnostic test, chorionic villus sampling, and percutaneous umbilical blood sampling. How is Down syndrome treated? The management of Down syndrome depends on the extent of the condition. Though a complete cure is not possible, an early intervention starting from birth can improve the quality and duration of life of the affected child. Speech therapy and physical therapy, assisted device, occupational therapy, emotional and behavioral therapy, and inclusive education. Patau syndrome. Patau syndrome, also called trisomy 13, is a chromosomal condition associated with severe intellectual disability and physical abnormalities in many parts of the body. Individuals with trisomy 13 often have heart defect, brain spinal cord abnormalities, very small or fully developed eyes, extra fingers or toes, an opening in the lip or without an opening the roof of the mouth, and weak muscle tone. Due to the presence of several life-threatening medical problems, many infants with trisomy 13 die within their first day or weeks of life. Only 5% to 10% of children with this condition live past their first year. Symptoms of Patau syndrome include cleft lip or palate, clenched hand with outer fingers on top of their inner fingers, decreased muscle tone, extra fingers or toe and small head. Rates of Patau syndrome has a prevalence of 1 per 6,500 births. Most fetuses with Patau syndrome die in utero or are stillborn. Diagnosis of Patau syndrome is genetic tests such as prenatal screening tests or pregnancy ultrasound tests. There is no specific treatment for Patau syndrome. Treatment varies from child to child and depends on the specific symptoms. Edwards syndrome. Edwards syndrome is a genetic disorder caused by the presence of all or part of an extra 18th chromosome. It is the second most common autosomal trisomy after Down syndrome that carries to term. Signs and symptoms of Edwards syndrome are a low birth weight and a small jaw and mouth, An abnormally shaped small head, small fingernails, short sternum, and Hirsch defect. Edwards syndrome on average in 1 out of every 5,000 babies. Girls are affected far more commonly than boys. Any woman can have a child with Edwards syndrome, but the risk increases with increasing maternal age. There are two different times that diagnose Edwards syndrome: during pregnancy and after birth. Pregnant women are offered screening for the Edwards syndrome between 10 and 14 weeks of pregnancy to assess the chance of their baby having the condition. During the combined test, you will have a blood test and spatial ultrasound scan where the fluid at the back of the baby's neck is measured. After birth, if doctor believes a baby has Edwards syndrome, when it is born they will take a blood sample from the baby. This will be examined to see if the baby cells have an extra copy of chromosome 18. There is no cure for Edwards syndrome and the symptoms can be very difficult to manage. You are likely to need help from a wide range of health professionals. Treatment will focus on immediately life-threatening issues such as infection and heart problems. Approximately 5 to 10% of children with Edwards syndrome survive beyond their first year of life, requiring treatment that are appropriate for the broad and chronic effects that are associated with the syndrome. Thank you.